President Marketing for ICSIA. He is a recognized expert in the areas of cloud computing, security, networking, and is a featured speaker at several industry conferences worldwide. Vasuki is a seasoned service management professional with over 17 years of experience specializing in building right-sized infrastructure and tools to accelerate the service success. Prior to eGestalt, he was with Juniper Networks as Customer Service Manager. Vasuki is trained and HIPAA certified. If you have any questions, please send them via the questions function in GoToWebinar, and we will address them at the end of the presentation. If you would like a copy of the presentation, please send an email directly to Anupam or Vasuki. Their contact information will be given at the end. Thank you, Anupam and Vasuki, for presenting, and I'll turn the webinar over to you now.
Thank you, Mike, for the introduction. So in terms of the proposed agenda of topics that we'll cover today, I'll start off by talking about, give a high-level overview about HIPAA and HITECH and what does it mean for small businesses and medical practitioners and providers. I'll also talk about some of the new changes that have been incorporated into HIPAA HITECH based on the new laws that have been passed and the enforcements that have happened and are coming. Then I'll talk about best practices and caveats. You know, what are the commonly overlooked issues that we need to be careful about. This is based on experiences from talking to customers and our partners. And also we'll talk about what kind of automated tools can help here. We'll talk about Secure GRC SP. That's going to be Vasuki who's going to take over from me. And at the end, we will conclude this with Q&A from the audience. Before I start, I want to talk about the fact that HIPAA is a still evolving regulation. The enforcements are evolving. HITECH is evolving, and while we made every effort to ensure that the information presented is correct, but we cannot offer any assurances with respect to accuracy of the information. And because HIPAA HITECH rules and regulations are subject to multiple interpretation, so there is some subjectivity involved, and we are not attorneys, so I would urge you to consult your legal counsel, auditors, or advisors to be doubly sure. So having said that, let's talk about HIPAA HITECH. Where does it come from? What the purpose is? And talk about requirements and caveats and best practices in this realm. So HIPAA basically started out as the Kennedy-Kassebaum bill in 1996, and this was enacted by US Congress as the HIPAA law, and it stands for Health Insurance Portability and Accountability. So the primary objective for HIPAA when it was enacted was really to improve portability and continuity of health insurance coverage. That was the primary goal. And the idea was that all of this, the mechanisms and practices mentioned in the law would at the end of the day improve the quality of healthcare by combating waste, fraud, abuse, and by improving collaboration across different medical providers. And clearly that's possible and done through simplifying the administration of health insurance, among other purposes. So while HIPAA is known and has a reputation for privacy, the goal really was portability. It's about health insurance portability. And that basically has the ability to improve, as I said, collaboration, the quality of healthcare, and safety and efficiency of healthcare from the perspective of the end customer. So HIPAA was passed as a bill in 1996. In 2009, the HITECH Act was enacted, and this was part of the American Recovery and Reinvestment Act. And the objective of the HITECH Act was really to accelerate the adoption of what is called electronic health record among different providers. And it also provided some enforcements and some guidance with respect to HIPAA, the law that was passed in 1996, to ensure faster adoption of the HIPAA laws through some incentives as well. So the objective of the HITECH law, again, just like HIPAA, was not really around technology. Certainly technology is a part of it, but the broader objective is to improve the quality of healthcare, improve efficiency of delivering healthcare by increasing collaboration and care coordination. It's also about providing the rights, the privacy rights and security protections for personal health information. And also by engaging the patients and families in the healthcare process as they work with the medical providers and the healthcare plan providers. So this is about putting together and streamlining better processes using technology as a means while ensuring that the efficiency of the healthcare administration process goes up. So as you might already know, that the HITECH Act is now effective. Parts of it are, parts of these laws were in effect since February 2009. There were some sections that came about that became effective around July of 2010, and some of it is going to be effective as of February 2011, this month. So all healthcare providers, and these are covered entities and business associates who deal with HIPAA HITECH related issues, need to be compliant, and I'll talk about what does it mean to be compliant. So with respect to HITECH, what really changed from the HIPAA Insurance Portability Act? One is that the penalties for not following up or following the guidelines laid down by HIPAA has gone up, and enforcement has become more proactive by HHS, Health and Human Services, have new funds that they've kept aside for enforcing HIPAA HITECH. There's more authority given to HHS and the state auditor generals to audit the covered entities and BAs. And not only the covered entities, the medical providers are required by law to be HIPAA HITECH compliant. The business associates that interact with the covered entities, and I'll talk about the exact definitions of what CE means, what a business associate means. But BAs are completely in scope, and not only that, they're liable to be, they're statutorily obligated to comply with the regulations, and their subcontractors also need to enter into contracts with the BAs. So the liability requires that CEs need to be obligated, and they need to comply. The BAs that they interact with also need to be are obligated to comply with, and also their contractors. So the entire set of process of interaction between CEs, BAs, and the subcontractors, each one of them in the chain, need to be compliant with HIPAA HITECH. Security provisions have been strengthened quite a lot in terms of what is now secured and what is in the purview of what is called PHI, personal health information. And there's a new data breach notification requirement as part of the security provisions that requires any breaches to be reported to HHS. And I'll talk about that a little bit as well. in terms of the privacy provisions, it's really about ability of an individual or a family to restrict usage of the personal health information. So there are new provisions now to enforce privacy, to enforce restricted disclosure, and all of this is through permissions, and the customers now have a right to review and amend that information as it resides. The penalties have gone up. I talked about earlier the penalties for violations were much lower. Now the highest penalty is up to 1.5 million, depending on the degree of the non-compliance, if it's willful and not corrected. And the fines could be up to 1.5 million per year. And it's not just a penalty, but there could be other fines that come along with it. If it's due to gross misneglect, one can go to jail as part of the enforcement. So it's become much more stricter, and the impression and the actions from HHS indicates that they're very serious about enforcing this. So the game changes from the HITECH Act is huge compared to HIPAA. So now HHS is going to be doing periodic audits. They've allocated multi-$100 million to audit Cs and BAs. Potentially they may not be able to get to every covered entity and business associate, but the idea is to do a random sampling, and if found in non-compliance, then fines are potentially huge. They are also, HHS is very incentivized to do these audits because they get to keep the fines, and also they share the fines they also use the fines to fund the agency, so there's a lot more motivation, and they also share the fines with the whistleblowers and other individuals who are affected. So there is an all-round ecosystem being created to ensure compliance with the HIPAA HITECH laws. I talked about the state auditor generals also being authorized to bring in lawsuits. Business associates are obligated along with the CEs, and the subcontractors also are contractually obligated. I talked about the audits now are part of the mandate from the law, from the HITECH law, which essentially entitles and authorizes the secretary to conduct periodic audits for covered entities and business associates, and this is something that took place in 2010 as a law. Red flags rule is essentially about trying to detect patterns where identity theft might be happening, and it's the responsibility of the covered entity and the business associate to detect this and prevent it proactively. A quick definition of a covered entity: it basically takes into purview any healthcare provider or a health plan provider or a healthcare clearing house, as long as they deal with information in electronic form for which is covered under the purview of HIPAA HITECH. So if you're doing billing using codes that HIPAA HITECH has defined, you are liable to follow HIPAA HITECH law. So it's pretty broad, and it pretty much covers most of the healthcare providers and covered entities that are out there. I talked about business associate also being liable, and that's a critical part of the law as well. So anybody who accesses personal health information and deals with covered entities needs to have an agreement in place with their subcontractors and with every CE, every covered entity that they interact with. An example of business associates are the following. It could be a health plan administrator, it could be a CPA firm, it could be an attorney firm, it could be a transcriptionist. Anybody who interacts with a covered entity and deals with personal health information is now liable to be compliant. adding some more color to what is covered in PHI. What is that brings about the notion of HIPAA HITECH coverage is really the ability to deal with PHI in a secure fashion and to comply with all the privacy and security requirements. So PHI is essentially any information, any individual information or family information that deals with medical conditions, deals with any payment related information, or it deals with any information that can point back to the individual. So it could be name, address, birth date, social security number, or healthcare information, or family information. So it's been pretty broadened by HITECH in terms of what the definition for PHI is now. In terms of the privacy element of HIPAA, individuals and families have expanded rights, which means that they have right to information, they have right to privacy of the information, they have the right to access the information, they can restrict disclosures of the PHI to various health plan providers, and also extend the privacy and security rules to business associates. So there are limits on what can be done with the information, with the PHI information, whether they can use it for marketing information or not. Everything needs to be authorized from the end customer perspective. And if a CE is sharing the information with the BA, those privacy and security rules are applicable by transition as well. So all of this is in the purview of the law, and businesses need to take this into account as they're thinking about compliance. So what does it mean in terms of all these different laws, HIPAA HITECH? What does it mean, and what can we do as a healthcare provider, as a small business, to deal with all these different requirements coming in from HIPAA HITECH? And if you take a step back, really all of these regulations and requirements are coming from the point of view of improving healthcare, improving portability of personal information, improving collaboration between healthcare providers, and also it's meant to improve the patient trust in how the PHI information is going to be used. And having the right processes, the right healthcare IT infrastructure to improve and make all of this happen is really the key purpose that HIPAA HITECH is trying to achieve. So when it comes down to security, the bottom line is that PHI, the personal health information, needs to be secured wherever it's encountered. If it is sitting on the database, when it's sitting in a location at rest, whether it's on servers, laptops, mobile devices, they need to be secured. They need to be encrypted, they need to be backed up, there needs to be access control to ensure the right people who are authorized to access that information get access to the information. If it's in transit, if it's being transmitted from one location to the other, from a CE to a business associate, through a web, or if somebody's traveling and they're dialing in using VPN access or using a cell phone, all of those accesses needs to be secured. The permissions need to be taken from the customer with respect to what information goes over the wire, what information gets shared by whom. And there should not be any non-secure communications used for PHI information exchange, such as standard email or sharing information on public portals. And I talked about it's very critical that every PHI exchange, whether locally, within the same office across different locations, or between different entities, covered entities, and business associates, etc., must be documented and permission sought from the customer. So the principles of sharing only a limited data set as and when needed with permission. And this brings about new challenges in terms of how the privacy procedures and security procedures need to be implemented to ensure all of this is followed. And clearly this, at the end of the day, patients want easier access. So it's something that they've been asking for, being able to walk in from one provider to the other and be able to look up the medical case history or look up the information or the treatment given to the person from a different doctor. So all of this is required by end user demand, but a lot of care needs to be taken to ensure that the HIPAA HITECH requirements with respect to privacy, security, and safeguards are not violated. So what can CEs and BAs do to help and get HIPAA HITECH regulations implemented? One thing I talked about is that making sure the data is secure, that the breach risks are minimized. And how can we do that? One is to ensure that all PHI information is encrypted. And if there are physical copies of personal health information, that's being uploaded, that's being copied in a faxing machine or a copying machine, all of those PHI information needs to be handled by authorized persons, they're destroyed after use, and we need to ensure that all of this is done in a secure fashion. No insecure methods of communication should be used when it comes to PHI. So emails, non-encrypted emails, a big no-no. Using social networking sites is a big no-no. And all tools, web tools used for communication with patients need to be secure. They need to use secure technologies like SSL-based web technologies and encryption to ensure that data is secured and moved around in a secure fashion. Also, from the covered entity perspective, they need to ensure that business associates that they deal with they have an agreement with them to comply with HIPAA HITECH, to comply with the requirements that it enforces to deal with PHI data. And not only that, if PHI is being handled by a shredding company, they also need to enter into an agreement to ensure that any kind of handling of PHI data, whether in electronic form or physical form, needs to be handled properly under contractual terms. And if there's any doubt about sharing PHI with anybody else, it's best to ask patient-specific information. So HHS recommends the following information security process. You start off with identifying and assessing the new risk and updates at any point in time. That's how our organization would start off typically to understand what is the status of the compliance today. And that is basically done through a self-assessment, which kind of outlines the gaps that exist. And then once you understand the gaps that exist, entities need to put in place some safeguards, which could be in the form of administrative, physical, or technical processes, implementation of the IT infrastructure, and then you go back and again measure yourself against what the best practices are, and this thing continues on an ongoing basis. A bit more detail on what exactly the security and compliance process is. As I talked about, we need to start off with a security and compliance assessment, which results in a report on compliance and a gap report, which talks about what the current gaps are and what the risk pertaining to those gaps are. There might be a number of gaps, but if it doesn't lead to a lot of exposure, some of those gaps might be manageable through other compensating controls. So understanding the risk of the gaps is very important, and then putting together a remediation plan, a strategy, and a set of contracts to implement a process that is followed by the company by the employees. It might involve some training with best practices with respect to who gets to view the PHI data, who gets to handle the PHI data, etc., etc. And then once those processes are implemented, you go back and evaluate where you stand, and this process is an ongoing process that typically gets you to compliance. So the question is, what prevents users from becoming compliant? One of the key challenges that we've heard is that the solutions out there are very expensive, very complicated, and it's very hard to understand what do we do and where do we start. And we hear that. The other thing that we've heard from some of the users is that, what are the chances of me getting caught? So yeah, I think that would have been a good argument before February of 2010, before HITECH law got enacted. But with HITECH, the chances of enforcement have gone up many-fold. And the penalties, the criminal liability is much, much bigger. So the question is it worth the risk? And if you look at some of the data that's out there with respect to the security attacks and the attack on the personal health records, these are pretty amazing and pretty devastating kind of numbers. Roughly about 500 million US customer records have been compromised since 2005, and the sophistication of the attackers are on the rise. Last year, about 50% of these records were compromised just in 2010. So there is a huge need to protect companies, small businesses to large enterprises who are being attacked. And what these cyber attackers are really going after is really the information that HIPAA HITECH and some other compliance regulations are trying to protect. So it's personal information, credit card information, bank information, and so it's no longer just sufficient to kind of assume that we as a business would not be under attack or we would not be compromised. And the risk and liability exposure of getting attacked, getting compromised is just too big. And these breaches are happening more frequently than we would like. The breaches have cost healthcare industry about $6 billion as of last year, and the number is growing. There was a report a few days back that there were 6 million records that were compromised between August 2009 and December 2010. And mind you, these were the ones that were reported which had more than 500 people records being involved at one instance. So, and business associates accounted for about 40% of all these records breached. So these are growing by the day, and these are very real threats and attacks that are happening. And I talked about the liabilities. The penalties have gone up. The criminal liability is out there, and HHS is very, very serious about enforcing this. So this is something that cannot be brushed aside, we believe, and just we'll take it as it comes kind of a scenario. Now HHS has something called a wall of shame, which is really a URL on the HHS site that really documents, and this is required by HITECH, that any breach that affects 500 or more individuals needs to be reported to HHS. Otherwise, you are in violation. And this wall of shame essentially has a list of all the breaches that have happened starting February 2010. And you can find all kinds of entities in here. Hospitals, business associates, small practices, everybody is showing up here. And so this is something that we need to be careful about, not to show up on that wall of shame. I want to talk about the relationship between compliance and security. So compliance is really a set of best practices that lead to security. And it's important to realize that compliance is not a one-point event. It's not a one-time event. It's a process. It's a journey. And typically, you might be compliant at any point in time, but if you're not putting best practices in place, you might fall out of compliance, and guess what? The cyber attackers or the threats might come in and breach you. So it's very important to not look at compliance as a point in time, but a process and implementation that gets you to a point of constant and continuous compliance. And that's really a key tenet of being HIPAA HITECH compliant, which is to ensure that there are repeatable processes, there are repeatable mechanisms, IT infrastructure in place that allow you to not just be compliant at a particular point in the year, but you're compliant all the way through. So let me now jump into Secure GRC and talk a little bit about the automated tool that helps you get to compliance and address some of the requirements and challenges that I talked about from the HIPAA HITECH compliance point of view. So Secure GRC is a software as a service subscription that you can buy, which allows you to deliver a security and compliance automation solution. And there are two flavors of the product that are available. The small business version is for small businesses that allow you to do self-assessment and collaboration and move in the direction of HIPAA compliance or PCI compliance. And then we have a full-blown version of the tool, which is called Secure GRC, which allows you to do a number of other regulations and also gets you ready for level 1 and level 2 audits. So diving a little bit more into what Secure GRC SB does, it basically takes the HIPAA HITECH regulations and demystifies it by creating a set of self-assessment tool which allows you to understand what the current status is and what the compliance gaps are, what the security gaps are. It's again a SaaS, software as a service subscription model. It also tells you what the risk exposure is with a risk score so that you can focus on the most critical events. And then there are a number of policies and templates and best practices and recommendations that are part of the tool that allows channel partners to work with small businesses and medical providers to customize it to deliver a complete solution for that particular business based on the need. And I talked about the go-to-market strategy being through channel partners. So we have channel partners all over the US, and depending on your need, they can come in and help you get started right away. So with that, I would hand it over to Vasuki to take you guys from here onwards.
Thanks, Anupam. If you could just give me the control.
Yeah, you should have it now.
Okay.
Do you have it?
Yeah, I'm in the process of getting it.
Okay.
Okay. Can you guys see my screen?
Yep.
Very good. Thanks, Anupam. Thanks, Mike, for the introduction. My name is Vasuki Nath, and I am the Director for Technical Services at eGetStart. A few of the slides that I would walk you guys through is how the Secure GRC is going to help working with the solution providers, which we call the managed compliance providers, to help you meet the majority of the requirements for being a HIPAA compliant. So with that, some of the regulations that are covered in Secure GRC SB tool is pertaining to the state law preemptions. We do address record keeping and access. Some of the transaction standards that are set forth by the HIPAA regulations by the CMS and HHS. the standards for the electronic transactions, the various transactions that the business associates would work with the CEs, and the CEs would work with various other entities within the HIPAA. Regulations that are primarily focused for security, privacy, and administrative standards, which are more focused coming in from a security perspective, the technical safeguards, the administrative safeguards, and all the other aspects of the general standards that needs to be followed for being HIPAA compliant, and the health information technology standards, which are pertaining to the electronic medical records and some of the other stuff that Anupam talked about. So these are the regulations that are covered within the Secure GRC SB. To go with, in terms of the life cycle that Anupam talked about, the way we do it is with the security and compliance assessments and the specific business requirements, the process and best practices, and the security evaluation, all of these are done in association and working with the solution providers to help you meet the required compliance. Some of these could directly come from out-of-the-box solutions coming in from Secure GRC tool, and some of these could come in an association working with the MCPs in using the templates, the documentations, and some of the stuff that we have customized and made it available, so the MCPs can work with the end users in terms of making sure to attain the compliance requirements here. The first and the foremost that I would walk you guys through is the security and compliance assessment. One of the first requirements, as Anupam articulated previously, was to go through a risk analysis. The way that we do it, we meet this requirement by providing all covered entities and business associates with a web-based assessment for both the data, for doing a self-assessment for the data collection process. All of these questions that you see here, as I said previously in the regulations that we covered, there are specific regulations that we are addressing, and there are specific questions that we have built which helps in terms of being compliant. For example, the assessments here are pertaining to 160, 203, 204, and 310 are very particularly focused on the state preemptions, some of the requirements that are pertaining to those standards, the transaction standards, and things of that nature. So these slides gives you a glimpse in terms of how we have built these questions that are pertaining to a specific requirements and the regulations. And additionally, we have also provided a help text in terms of providing information in terms of easy answering those from a customer, from a CE or a BA's perspective. These are some of the self-assessments that are covering for 160, 920, and thousands, which are pertaining to the code sets and transactions. Some of the security, administrative, and technical safeguards are all covered in 164s. And we have also covered some of the high-tech requirements in 170, or 210, and 202 series. We also have the self-assessment that are pertaining for the BA too. So all these questions allow a yes or a no responses, and they provide the end user with a detailed health information. Sorry, the detailed health information. Additionally, where required, we also provide the ability to upload required policies and documents into the systems, meeting the continued compliance requirements, as the files are then stored electronically for review mechanisms. Once these assessments are completed, the MCPs will then work with in looking through the various gaps and provide or issue a report to the end user responses. And that's where we come in terms of looking through the business specific requirements, where we go back, look through the various risks that are associated, and then come out with a specific remediation plan, and then we work through to make sure that all the risks that are identified are mitigated. So if you go, when you look through these, the responses are coming in from the self-responses that are coming in are then calculated and aligned with risk values, ultimately providing insight into your environment with a specific risk rating. The details are then reviewed by the service providers, and a remediation plan as well as the security strategies are then conceptualized and presented either to the BA or to the CEs. Coming to the compliance process and the best practices, as we have emphasized, this is not a one-time activity. This is an ongoing process. And to facilitate this ongoing exchange of information, what we have done is we have built in a lot of best practices and specific training materials around the social networking, the email proper usages, and various other things, as you see here. And we have populated all of these to our partner portal, which would be used by the MCPs in terms of working with the end customers and using this. Secure GRC has provided all these informations through a web portal, which will be accessed by the MCPs to help in mitigating the HIPAA compliance. Finally, in terms of the security evaluation, what we provide is a detailed report of the self-assessment in terms of the responses that are collected through the life cycle process, especially focused on the areas of the most concerns or the gaps and the remediations that are required. This report is then provided to a business as a delivery presented through a compliance report, what we call as the HROC, or the HIPAA report on compliance. And then we go through in terms of providing this so that the gaps are remediated and the new assessments can be provisioned. And again, this goes as an ongoing process. So as we said, this is an ongoing effort and not a one-time activity. So to come to this, some of the actions that you should take now are to focus and build data breach response plans, go through making sure that you go through the HIPAA security compliance process through a self-assessment process to identify where the gaps are, what the remediation needs to be done, plan for all the activities in terms of securing some of those that are being identified through the gap process, review the compliance resources that are made available working with the MCPs. And now with that, I will turn it back to Anupam for his next closing comments. Anupam?
Thank you. Thank you, Vasuki. So in conclusion, what I would say is that Secure GRC SB essentially has distilled the entire HIPAA HITECH regulation, and we have essentially culled out the relevant portions that are pertinent for small businesses. So some of the demystification of HIPAA HITECH laws, regulations, and trying to interpret them and making sure what is applicable for small businesses is really part of the solution. And this allows you to address all the steps that Vasuki talked about that are required as action items in terms of assessment, planning, tactically securing the data, building a plan. All of those are available through Secure GRC SB tool, either out of the box or by working with channel partners who would help you get there. And I want to re-emphasize that HIPAA compliance is a journey, and HIPAA compliance is really about security at the end of the day. It's about best practices. It might seem like a lot of work in the beginning, but really it's about risk versus benefit analysis, and it's going to be adding a lot more trust factor for your customers, and also is about bringing down the cost of and improving the quality of healthcare, and also making healthcare more easily available and portable. So I would urge you to reach out to us or reach out to any of the channel partners in your region. If you need any contact information, please reach out to us. We can connect you with the right people. If you want to get a demo of the product, we're happy to provide that. With that, I would open it up, and I have a number of references at the end of the presentation, which gives you more details about about this. If you're interested in learning more, or feel free to reach out to us. We are happy to help in any way with any doubts and clarifications. We'll try to do that to the best of our ability. With that, I'll open it up to any questions from the floor. My contact information is here. Vasuki is down there. Feel free to reach out to us at any point in time. Mike?
Thanks. Yep. Thank you, Anupam and Vasuki. We'll now open it up for questions. If you have any questions, go ahead and you can ask them via the GoToWebinar function there on the right in the questions area. Anupam, we have one question. Are you ready?
Okay.
Why is Secure GRC SB unique?
So there are a couple of reasons. One is, as I said, we have demystified HIPAA HITECH and ensured that the regulations and the requirements for a small business perspective, from a small business perspective, is distilled, and SB essentially takes a self-assessment approach to understanding the compliance and security status, and then putting together a set of remediation plan to get to a compliance stage. So its applicability towards small businesses is a key requirement, and then making the tool easy and cost effective. We are very cost effective, at least about 5 to 10x cheaper than anything that's out there. And it's a combination of all of that that makes us unique.
Okay, great. Thank you. Next question. Do physical therapists fall under HIPAA HITECH now?
Vasuki, you want to take that?
Yeah. Sorry, say again. What was the question, Mike, again?
Sure. The question was, do physical therapists fall under HIPAA HITECH?
Oh, yes, they do. So the way that I would look at it is the physical therapist would be an extension of providing a service to the patients referred by the doctors or the CEs. So at times they could be a CE, at times they could be BA, depending on how the contracts are and how they deal with the PHIs, which is the personal health information records.
Yes, the short answer is yes.
Okay.
If they're dealing with patients, if they're dealing with patient health information, then they are under the purview of the HIPAA HITECH law.
Okay. Next question. How soon can I get started? Do I contact eGestalt or do I find a channel partner?
Yeah, so as I said, reach out to me or Vasuki, and we'll connect you with the right channel partner. If you're an end customer, if you're a channel partner who wants to offer the service, please feel free to contact us, and we'll get you. We can have discussions on how to get you started, if that's the right thing for you to do. So yeah, reach out to us, and we'll get you connected one way or the other.
Thank you. What is the annual cost of the SB version and GRC Enterprise?
Sure. So the SB version starts at an end user price of $500 a year, and it goes up from there depending on the complexity of the deployment. But if you are like a 1 or 2 physician's doctor office, you can get started with as low as $500 a year. And then if there are multiple locations, or if there are other complexity in terms of how you handle PHI data, it might go up from there. But it's meant to be cost effective. It's meant to be affordable, so that we believe there's a huge need out there for small businesses to be HIPAA HITECH compliant, and the solution has been priced to make it available and usable by everybody.
Okay, thank you. Do you also work with behavioral health facilities?
Yeah, sure. I mean, if there's a specific question around, what can be done with those folks, please feel free to contact us. We're happy to talk to you in detail about behavioral health facilities. That's something that we can discuss in detail.
Okay, one last question. As an IT consultant, will it fall under my responsibility to keep them a client in compliance?
Well, if you are the anointed compliance officer or the security officer in the organization, then sure. Typically, an organization needs to appoint a designated compliance officer, and that person could be an IT person, that could be an administrative person, office manager, whatever have you, depending on the size of the organization. So that person is responsible for HIPAA HITECH compliance, and as an IT implementation consultant, the idea is that you would enforce some of those practices and tools and best practices in the organization. So yes, you are affected one way or the other.
Okay, great. Thank you very much. That's it for the questions. There are no more. Thank you for joining us for today's eGestalt webinar, and thank you to you, Anupam and Vasuki, for presenting today.
Thank you.
We'll have a recording of the webinar available on eGestalt's website at www.egestalt.com. Thanks again, and have a good day, everybody.
Bye for now.
Thank you.